Hi, Katrina Rothenberger, Public Health Division Director for Marion County Health and Human Services. As of today, October 21st, we have 5,589 cases of COVID-19 in Marion County. 106 people have died and 62,394 people have been tested. For the week of October 11th through October 17th, we saw 260 new cases with a 9.7% positivity rate. However, our testing rate was slightly lower than the previous week at 80 per 10,000 tests. This is down from last week. Last week, the week of October 4th through the 10th, we saw 276 new cases. On Monday, October 19th, the Oregon Health Authority updated their face covering guidance and recommendations. We're now required to wear a face covering or mask instead of a face shield, except in limited situations when a face shield by itself is appropriate, like talking to someone who is deaf or hard of hearing and needs to read lips to communicate. The guidance now requires that people wear face coverings in all private and public workplaces, including classrooms, offices, meeting rooms, and workspaces, unless someone is alone in an office or in a private workspace. They're also requiring face coverings at outdoor venues, such as outdoor markets, street fairs, and public and private universities. Recently, we've seen an increase in COVID cases, both nationally and statewide. And as we move into the holiday season, we're looking to have friends and family over for holiday parties. We want to remind people to limit your gatherings to 10 people or fewer. And the CDC director, Dr. Robert Redfield, says that small indoor group gatherings are driving the current spike of new COVID-19 cases and hospitalizations in the United States. And in Marion County, we've seen an increase in sporadic cases. We're also seeing the household and close contact cases as well. But the sporadic cases means that we can't necessarily trace where someone came into contact with the virus because they either don't know where they got it from or may be refusing to talk with one of our case investigators. And this is why it's really important that we're limiting our indoor gatherings to 10 people or fewer, because we might have been exposed and not knowing it. We don't want to spread the virus to our friends and family. And then just a reminder about what contact tracing is. And in Marion County, we've been doing this for years. It's a tool that the health department has been using to track infections and diseases in our community like measles and tuberculosis. And if you're contacted by one of us, one of our contact tracers, it's because you or someone you know has been exposed to this virus. And our goal is to make sure that people have the information that they need to protect themselves and their families, and know that your information is private and will be treated as protected health information. Your personal information will not be shared with other agencies, including immigration officials. We take personal health information very seriously, and it really helps protect the integrity of our investigation if we're private. So please answer the call. And then there will be a free drive-up testing event in Woodburn this Saturday from 11 to 2 at Woodburn Ambulance. Pre-registration is now open, and you can visit us at covid-19.mchealthy.net for a link to the event and to sign up. And last, we are in flu season, and it's not too late to get a flu shot. It's a very simple thing that we can do to keep ourselves and our loved ones healthy this fall and winter. And it's really important to get a flu shot. It won't protect you against COVID-19, but it will help prevent respiratory illness in our community and respiratory hospitalization. So they are available through most healthcare providers, clinics, and pharmacies. So don't hesitate and get yours today if you haven't done so. Thank you.
Thank you, Katrina. Appreciate it. Any questions?
Well, I'm not going to get political just yet, but probably I'll bust out before the end of this meeting. But I do have one. So I watched a commercial last night that tells me an old guy like me is supposed to get a double dose. They never offered it. Is that important? They have a super dose. I thought so. Marketing.
I'll look into it.
Or are you going to come and jab me again? Is that what you're trying to say?
I might.
All right.
When you least expect it.
I'll do it.
Okay. Thank you.
I got my single dose.
Yeah, me too.
We know, there's video documented
You young
evidence.
guys, have you got yours?
I don't comment on my health care in public,
Oh,
believe it or
okay.
not. I actually believe in keeping privacy for healthcare, personal healthcare.
Was this some new standard I gotta deal with? What?
No, it's actually why we have a federal law called HIPAA to protect people's private healthcare information.
Okay, I probably had the double dose then, if that's the case.
Thank you,
Thank you.
Katrina. Appreciate it.